Hey everyone, in this lesson we're going to talk about agoraphobia and how we diagnose agoraphobia. So agoraphobia literally means a fear of the marketplace. And sometimes we hear this phrase that agoraphobia is a fear of fear. Patients generally are afraid of having a panic attack in certain circumstances, which leads them to avoid those certain circumstances. So agoraphobia is itself on what I call the spectrum of panic attacks and panic disorder. And we usually say that it occurs in conjunction with panic disorder. Remember, panic attacks are 4 or more of the student's fear 3 C's. The lifetime prevalence of agoraphobia ranges from 1.1% with panic disorder, and then another 0.8% that occurs without panic disorder. Agoraphobia has certain risk factors. Some of these include being younger, young age, being of the female gender, having panic disorder itself, and having other phobias. So having a panic disorder or other fears or phobias can increase your risk for having agoraphobia. So how do we make the diagnosis of agoraphobia using the DSM-5 criteria? Well, it starts with the A criteria. A criteria for agoraphobia is marked fear or anxiety about 2 or more of the following 5 situations. And I like to call this lap toe, and that's why I have a picture of a toe on the right. So lap toe, so the L stands for lines, so standing in line or being in a crowd. A for alone, being outside of home alone. 3, or PT of lap toe, is public transportation. The O is for open spaces, and the E is for enclosed places. So agoraphobia, the A criteria for agoraphobia is a marked fear or anxiety about 2 or more of the following 5 situations. So we need 2 or more of lap toe, and those 5 situations are lines or standing in line or being in a crowd, being alone outside of the home generally, public transportation, open spaces, and enclosed places. So remember those 5, think of lap toe, and the PT is for public transportation. So if we have 2 or more of those following 5 situations that the person has marked fear or anxiety about, that is the A criteria for agoraphobia. So the B criteria for agoraphobia is that the individual fears or avoids these situations because of thoughts that escape might be difficult or help might not be available in the event of developing panic-like symptoms or other incapacitating or embarrassing symptoms. So that's why I generally call this on the spectrum of panic disorder. The person generally has panic-like symptoms or other types of symptoms that become incapacitating or embarrassing, and generally these may involve symptoms of a panic attack, and they are afraid of having these symptoms in these 5 different public places because they're afraid of being embarrassed or they're afraid of being trapped. They're not able to escape. So they have fears or avoid these situations because of those thoughts, because that they're afraid that they might not be able to escape or they might be embarrassed in some way. The C criteria is the agoraphobic situations almost always provoke fear or anxiety. So we need to show that almost every time the patient is in this situation, they have a provoked fear or anxiety. The D criteria are that the agoraphobic situations are actively avoided, they require the presence of a companion, or they are endured with intense fear or anxiety. So these all fit together. They avoid the situations, or they only go out in these 5 situations with a companion, or they do those, or they go to those situations but they have intense fear. So can either be avoided, they can have someone with them, or they can go by themselves but they are endured with an intense fear or anxiety. And the E criteria is that the fear or anxiety is out of proportion to the actual danger imposed by the situations and to the socio-cultural context. So it is something that other individuals in society, in that culture, don't experience. And the actual danger of each of these situations does not fit what the person is experiencing toward those situations. And the F criteria is that of the required time for the diagnosis. The F criteria is fear, anxiety, or avoidance of these situations is persistent, greater than 6 months. So in order to have a diagnosis of agoraphobia, we need 2 or more of lapto. We need the reason for fearing and avoiding these situations is because they're afraid they're not going to be able to escape, because they develop panic-like symptoms or other embarrassing symptoms. That the agoric situations almost always provoke fear or anxiety, that they're actively avoided, they require someone to go with them, or they are endured with intense fear or anxiety. The fear or anxiety is out of proportion to the actual danger, and that all of these things last for greater than 6 months. And the G criteria is that the fear, anxiety, or avoidance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. So once we made the diagnosis of agoraphobia, what are some of the treatment options? Well, the treatment options for agoraphobia are identical or similar to the treatments for panic disorder. Those include psychological treatments, CBT, interoceptive exposure, so they elicit the panic attack symptoms. They get the patient to learn to tolerate the symptoms without coping strategies. There's also cognitive restructuring, so they address underlying beliefs regarding the panic attacks, and there's also relaxation techniques. And for pharmacological treatments, there are SSRIs, so selective serotonin reuptake inhibitors, such as fluoxetine, citalopram, paroxetine, fluvoxamine, and sertraline. SNRIs like venlafaxine. We want to start low and go slow with these patients because there can be some symptoms or side effects of anxiety when we start some of these medications early on. Patients with agoraphobia and panic disorder normally require higher doses and longer periods of time of treatments to get a full response. So full response may take up to 12 weeks. We treat for up to 1 year after symptoms resolve and avoid relapse. And we want to avoid the use of bupropion or TCAs due to their stimulating effects, which may exacerbate feelings of anxiety in these patients. So anyways, guys, that was a quick lesson on agoraphobia. I hope you found this lesson helpful. If you did, please like and subscribe for more videos like this one. And as always, thank you so much for watching, and I'll see you next time.